Hi, welcome to chapter 2 for medical terminology. This one is going to be similar to the first one where we just kind of real quick. Because as previously discussed for medical terminology, there's only so much I can tell you. Most of it's based on you putting in all the effort. So we're about to go over the PowerPoint for chapter 2. And I'm going to pick very specific ones to kind of go off on my little tangents. And I guess that's all I've got to say to start off. So here we go. Oops, I almost hit the wrong button. All righty, so chapter 2, Introduction to Health Records. We've got our learning outcomes again. So main thing, I think most of you already know what a health record is. A lot of them are going to be electronic health records, but some of them will actually be paper. And the health record is going to contain information about the patient, obviously, because that's what a health record is. This may or may not include their previous illnesses or treatments, continuing medical problem, history of family illnesses, current medications. This all depends on exactly where you are and what job you have. Oh, this has nothing to do with medical terminology, but I have to say it. This is one of the big issues is a lot of them tend to be very compartmentalized. And so you might be missing a huge chunk. So please, for the love of everything, do not assume that the health record is everything, because the cardiologist record might not contain stuff from the urologist record and that kind of thing. So please make sure to also be willing to talk to a patient and whatnot. But anyway, there you go. Medical notes are supposed to be done in a very specific way in order to make sure everybody understands them. If you sit there and just use your own floral way of speech, it's not going to come across as clearly. That's why there is very specific terminology you're supposed to use. So chapter 2 is focusing on the organization of the medical documents. We have what is called the SOAP method. So that means subjective, objective, assessment, and plan. So subjective is what the patient says. Be very careful on this part. You need to desperately pay attention to what the patient says. A couple of reasons. One, sometimes something that they really don't think is all that important might be the big red flag that you need. Other times, it might be kind of hard to dig through. So you do need to pay attention to what the patient says. Objective, what did the tests reveal? Assessment, this is analyzing all of the information, and this is normally done by the healthcare provider. And then plan, this is the course of action for the patient. I recommend everybody think of, you can think of yourself if you want. I normally pick a family member and think about them and their medical stuff and then run this through. And you will see why I do that about the subjective, because clearly I think of my mom. All right, subjective. These are the problems that the patient states they have. They're not going to know the medical terms. So your job is to listen to what they said and put it in medical terms, but make sure you're not changing what they said, if that makes sense. General subjective terms, acute versus chronic. You need to know which one's which. Abrupt, all of these are very important words. Now, I'm not going to read them all, but you need to know all of these in order to include them because they're very important. Objective. This is the data collected by the healthcare provider. So this helps get all the info from the various tests and whatnot. So these are going to be things that you might see. So seen, alert, oriented, heard, felt, description, that kind of stuff. You need to make sure, look over all these and see which are the most important words to include. Your assessment, combination of the two previous. So you're going to take what the patient said with what you have observed, you put it all together in order to form the actual assessment. If it is not possible to bring it down to just a single cause, then you're going to have to give a variety, a list of things that it could possibly be, so you know what to look for. General assessment terms. We got a whole list here. So again, general. More and more. Plan. The plan is what the provider recommends to the patient regarding the current health status. So this is what the provider says they should do, whether it is make sure to drink more water or get up and walk around each hour, take your blood pressure medication properly. It doesn't, it's whatever. General plan terms. We got some more. All right. Now, body planes and orientation. Understanding this is important in order to jot stuff down. Because if they're saying that, say, they have a pain that's going down their arm, then you would be putting in there something about it being a distal movement. Anterior versus posterior. So anterior is the front, posterior is the back, this kind of stuff. So knowing the parts of the skull, which is why those of you who have taken anatomy and physiology 1 and 2 are going to have an easier time with some of this. Supine and prone, these are important. Well, I should say all of these are important, but this one is, well, a lot of this is going to be in descriptors. So they might say, like, when I'm thinking of my mom, because, I'm always going to think of my mom. She's got the most medical issues. If she says every time she's lying on her back, she notices her left arm is going numb, then I would want to say in the supine position, that kind of thing. Again, just more body planes and orientation. Oh, this just hurts my leg looking at those pictures. I really have nothing to say for these, so that's why we're just going through it. Health professionals, again, we've got the terms where you're breaking it up with the prefix, the root, the suffix, and the definition. So just more words for you to work on, practice, know. Sections of the health record. These records can be very, very long, or they can be rather short, but each of them are going to have these parts. There's going to be a chief complaint, history, review of the systems, past medical history, past surgical history, even if it's 0, family history, social history. All of you have been to a doctor before, so you filled all these out. So that's what's going to be here. Clinical note. You're going to type in your stuff. It is very important. Very important. I cannot stress how important it is to use the proper medical terminology and keep opinion out. There have been cases in the past where somebody typed something in there pertaining to their opinion of the person, and it went into the medical record officially, and it was a derogatory comment. So make sure you are working, putting your notes in like the entire world can see what you just said. So these are just examples showing you the proper way to do these things. Yes, it's like just a whole bunch of different reports and whatnot, showing you the way it looks. Areas of the healthcare facility. We've got a lot of acronyms here, so knowing what they mean helps, because you will get used to just blurting it out, but until you have ever been to, we'll use NICU as an example. If you've been to a NICU, you know what a NICU is. If you haven't, you don't know that means the neonatal intensive care unit. So you as a medical professional will get so used to it, you will just be popping these off right and left. But if you could remember your English training, where you say the full word first and then use the abbreviation. That would be great for when you're communicating with a patient or a person. Then, of course, we have our different abbreviations. Common health records. Used for symptoms or exam findings. So here you are supposed to be testing yourself. You're going to match each abbreviation with its correct meaning. It's kind of not super difficult because it's pretty much just acronyms. And then here, associated with orders and administrating medications. Again, here you're supposed to be matching the abbreviations with its correct meaning. This will be in your textbook, so it's a good practice. Timing and frequency. Now, summary for chapter 2. You should understand the SOAP method, health records, abbreviations, and whatnot. There is still more stuff to this PowerPoint, so let's see. Well, it's done. It tells me that there's 64, but oh, look at that. It's got a whole bunch of nones. Interesting. I wonder why it has all those. But anyway, that was it for the official PowerPoint for chapter 2. I know I don't add a whole lot on these, and I'm going to say it a lot, that for medical terminology, it's on you. You are the one who's really legit going to have to buckle down and just break it down. I'm here for facilitating purposes only. So it would be great to get feedback from you during week 1 before I do recording for week 2, if possible, so I can see if I can help you better. I kind of wish our classes were on Wednesday instead of Monday, so then you would be able to work ahead. So then in our classes, we could be covering your specific questions, because medical terminology is going to be a whole lot of me just, here's some basics, go forth. But that's literally all there is for medical terminology is here's the basics, go forth. So here's the basics, go forth. Peace out.